In this video, we will be using a condition to help bring all of the knowledge from the previous videos together. Brown-Sequard syndrome is a rare form of spinal cord injury which gives specific signs and symptoms. It is estimated to happen in 2% of spinal cord injuries. Usually this injury happens due to a penetrating trauma which physically severs half of the spinal cord. It can also be caused by a spinal cord tumour, multiple sclerosis, cysts, spinal cord herniation, haemorrhage, or infection. This injury usually damages half of the spinal cord in the cervical or upper thoracic levels. Patients will experience a total loss of position sense, proprioception, light touch, and vibration sensation on the same side of the injury at the level of the injury. This is because they have severed the DCML system and the spinocerebellar tracts, which provide this information, carrying it from the skin to the brain. The patient will have loss of pain and temperature since they have severed the spinothalamic tracts. This loss will begin a few segments below the injury and will be on the opposite side to the injury. This is because the tracts enter the cord and travel on the same side for a few segments, then decussate to the contralateral side. Severing the pyramidal and extrapyramidal tracts will mean that the patient will lose motor control of their limbs, so will have a spastic paraparesis, partial paralysis with muscle stiffness. This will be on the same side as the lesion, ipsilateral. So, if a patient severed the left side of their spinal cord and consequently had Brown-Sequard syndrome, what symptoms would they have? Pause here if you need to. They would have ipsilateral loss of proprioception, light touch, vibration, and they would have muscle stiffness and paralysis. They would have contralateral loss of pain and temperature. Management of this type of spinal cord injury includes the mobilization of the spine and identifying cases where surgery can be used to improve outcomes, such as Brown-Sequard syndrome caused by spinal cord herniation. Pure Brown-Sequard syndrome is rare, and usually the features of this syndrome are mixed in with other symptoms and signs of damage.